Hey guys, Curtis Alexander. I'm a pharmacist. In this video, I'll be going over the side effects that you can see with the prescription drug Adderall. So, as you may be aware, Adderall, prescription drug used to treat ADHD, hyperactivity disorder, it's actually two mixed salts, dextroamphetamine and amphetamine mixed salts. Now, what it does when you take it, you're going to see an increase in dopamine and an increase in norepinephrine. Norepinephrine is basically adrenaline. So the other thing I want to point out right off the bat before we get into the side effects, we see blood levels of immediate release Adderall, not the extended release, but the immediate release blood levels will peak at around 3 hours. Now, the faster something peaks and the faster it gets out of your system, the more abuse potential that we can see with it. So you do want to keep that in mind. Now let's talk about, I like to cover the most common side effects. And again, you already understand what it does in the body, so that will make a little more sense with some of the side effects. But these side effects and the percentages that I'm giving you are for adults only. For kids, we can see somewhat different side effects, and I'm going to kind of leave that out at this point. And some of these you can see in both kids and adults. But just keep in mind, if something's on this list that you're not seeing and you have a kiddo that's taken it, it is a little different. So anorexia, 22 to 36%. Again, the range tends to, you're going to hit that high end of the range, the 36%, as the dose goes higher and if you're taking an extended release formulation. But either way, we can see anorexia, decreased appetite, 22 to 30% of folks can see that. We see dry mouth, 23 to 35%, and then headache at 26%. So these big four here, pretty commonplace, and roughly 1 out of every 4 people is going to experience one of these when they take Adderall. Depending, again, dose, duration, extended release, immediate release, you can see insomnia. Again, we have increased adrenaline going on in the body, so a lot of this kind of makes sense. You can also see weight loss, 4 to 10%. Not a reason to take it, but it can be seen. Now, a couple of warnings I want to point out, and this is always important because when you have a medication that acts this way, we have to be careful about certain groups of people that we might be giving it to. One of those is people who have cardiovascular events, whether it's a heart attack or a stroke, or you have a strong family history of that. That's something you want to keep in mind before you move down this road. Also, we can see growth suppression in kiddos. The risk factors for that, we tend to be more worried if they're on higher doses and they've been taking it for a longer period of time. We're also concerned autism. If they're on the spectrum, then that can be a concern as well for growth suppression. If somebody has a history of psychosis or mania, like bipolar disorder, schizophrenia, we would be concerned about that would be a group we'd want to kind of pump the brakes on giving Adderall to. Again, if there's pre-existing conditions, young age can be a risk factor for these psychosis and mania, and also concomitant steroids like glucocorticoids, the prednisones, those sorts of things. And finally, we want to be careful if you are in the camp where you're taking any other medications that can increase serotonin levels. We do have concerns over serotonin syndrome happening. Not something I'd be overly concerned about. Just make sure that your pharmacy runs an interaction check before you or whoever your loved one is taking the Adderall. So let me know in the comments if you experienced any of these side effects with Adderall. How did you tolerate it? That's really helpful, not just for me, but for anybody else that might be watching the video, to kind of get your feedback on the medication and your thoughts on it. So I hope the video was helpful, you guys. I will see you in the next one. Thank you.